I had been down that hall 1,000 times. She had just signed the paperwork, all that legalese, the risks that we talk about. With the resident in tow, that's the junior surgeon, we walked towards the operating room. My surgical scrubs, which had carried me into so many operations before, pulled up in front of that automated glass door. And seamlessly it opened. I inhaled that odor of sterility, the cleaning solution we smell in the operating room. It was cold, 65, 67 degrees like it usually is. I put on my left glove, right glove, adjusted the lights. Time out. That's a process that we have before surgery where we make sure everybody's on the same page. And I did what we normally do. I rattled off blood pressure requirements. Don't forget the anti-rejection medicines, just like we normally do. Scalpel, 10-blade, incision. Suture, we first focused on the vein, 1 millimeter. Robotically, another millimeter, another millimeter. Onto the artery, 1 millimeter, another millimeter. Suturing just like we'd always done before. We took the clamps off, blood rushes in, blood rushes out. We focused briefly on the bladder. Great job today, guys. We did it again, 70 minutes. Business as usual. That is the transplant of a human organ. I am privileged to be a transplant surgeon. I get to care for people with organ failure, people who are dying of heart failure, liver failure, and kidney failure. Kidney failure is by far the most common disease that we treat. 1 in 7 people has kidney disease. As many as 2 million Americans could likely benefit from a kidney transplant, and 100,000 people right now are listed for that gift of life. Near miraculously, that operation works almost 100% of the time. That level of precision has taken decades of innovation, and individually, thousands of hours of training. For me, I got to do a lot of that training in chilly Wisconsin. Getting on small airplanes, negative 20 degrees at 2 o'clock in the morning, to fly to a small hospital and hold the hand of a mother who had just lost a child so that we could recover organs and get back on that plane and travel to the transplant center where we would hold the hand of another mother whose child had just received the call that they were going to get the gift of life. I've performed more than 1,000 transplants. And certainly there are a lot of doctors who have transplanted more. And when I first began, every transplant was just unadulterated enthusiasm and emotion. And over time, that has waned. Not because the operation is less valuable, because it's something that we just do every day. I've been very fortunate to run 2 very large transplant programs. And in an administrative role, our team was tasked with overseeing the revision of a consent form and consent process. How boring is that? But I thought to myself, what's the big deal? I got this. I could practically do this in my sleep. So I went through the form, line by line, word by word, all those risks and percentages that we quote for the surgery. And I did it, and we certainly got through the work. And as I poured through it, page by page, word by word, something was missing. Something was gnawing at me. Certainly we got through it, but I couldn't kick it. Something was off. I found myself the next day in the preoperative suite. Kidney transplant 1001. And we went through it. We went through the percentages and the legalese. And she signed the form. And then I found myself sitting on the corner of her bed, looking eye to eye, face to face, with a 65-year-old woman who was staring down death. And I knew immediately what was missing. It was her. And I said, "Ma'am, why are we doing surgery today?" And she looked at me with a pause and cocked her head to the side. And she said, "You're the doctor, right?" And I said, yeah, I'm the doctor. But why are we doing this? She said, because I need a kidney transplant. I said, yeah, I got that part. We had a kidney part. But why? And she says, because I'm on dialysis. That's that therapy that we use to clean the blood of patients that are waiting for a transplant, hoping to get that gift of life, worrying, will they ever get a shot? I said, I know that you're on dialysis, but why are we going to do the transplant? She said, because I want to come off dialysis. I said, why? She said, because I want to live. And I said, why? And it was in that moment that life just showed up. Because I'm a mother. I'm a grandmother. You see, I got two grandkids. They're in Tennessee. I can't see them. I'm nervous I'm going to get sick. He's 10. He plays soccer. She's 7. She plays the piano. I really want to get there, but I don't want to miss my shot, and I don't want to get sick. We headed to the operating room again. My clogs pulled up against that door, and it opened. Left glove, right glove, lights. Time out. But instead of rattling off the blood pressure medications, I paused. I looked to the left. I looked to the right, looking over my surgical glasses. I said, time out. We have a mother. We have a grandmother. You see, she's got 2 grandkids. He plays soccer. She plays the piano. They live in Tennessee, and she can't get there. And because we are here today, we are going to send her to Tennessee. Hell yeah, we are, from anesthesia. Oh my God, that's so great, from nursing. Music up to 120%. Let's get this thing done. Today, we are going to Tennessee. I have now asked this question of more than 100 patients. And I'll bet you'd like to know what they say. I've heard many things. A 58-year-old woman looked at me. I said, why are we doing this transplant? And she said, Zella, and this is going to last me 28 years. And I said, this kidney will last you 28 years with that attitude. Who is Zella? She said, Zella's my granddaughter. Zella just turned 2. And I told Zella she's not allowed to get married until she's 30. And God willing, I'm going to be at that wedding. I said, absolutely. Friends and family. Another time I looked at a 55-year-old man, very serious, and I said, sir, why are we doing this transplant? And with all seriousness, he looked me in the face. He said, work. I'm here to work. I take care of my kids. I'm going to send them to college. I pay the mortgage. That's what I do. He's important to himself and to his family and to everybody in this room because he is the forklift driver for the boxes of powdered cheese that have graced every Cheeto you've ever eaten. But work was important to him through purpose. A 72-year-old woman, I was looking at her right before surgery. I said, why are we doing this? And I knew the answer. I knew it. She was going to say her grandkids. They always do. And she's the grandmother we all know. She's about 72. She looks like she ought to be in a rocking chair with like a doily and like the lemonade. And I said, I'll bet this is going to be the grandkids. I said, man, why are we doing this transplant? She got a big grin. She said, Vegas, baby. She was going to take her girlfriends on a trip to Vegas, experiencing the world. 11:30 at night in the preoperative suite, it's cool and it's calm and there are very few lights on. I found my patient nearing midnight under a single light in the corner of the preoperative area, and I went up to his bed. He was 35, way too young to be in my care. Dimly lit, late at night, I pulled up to his bed. I said, sir, why are we doing this transplant? He said, to praise God. That's very powerful. I'm Mom! From the corner of the room, I tried to peer around the light, and somewhere between all the linens and the drapes, I saw Mom silhouetted in the corner. She said, I'm Mom. He's my son. And he's a singer. That's how he praises God. He praises God at the church. And I looked back at him and said, is that true? That's beautiful. He said, yeah, that is true. And he was quite embarrassed that his mother was bragging about him. And it was in that moment that a hush came over the preoperative suite as he delivered the most beautiful rendition of Amazing Grace to everyone that was in that preoperative suite. There was not a dry eye on the surgical team. in that preoperative suite, or I think in the entire city of Charleston. You see, in reflection, diving into the lives of all of these people who are facing death with uncertainty, but then get another shot, is a unique experience on asking ourselves, what are the reasons to live? And when I reflect on each of them, it strikes me that they only fall into one of four categories. Friends and family, experiencing the world through travel, purpose through work, and God. Now, this is an interesting list. It's interesting for the things that are on it and for the things that are not on it. One of them is work. How many people would say, man, I live to work? Well, I challenge you. That's a luxury. And until that is taken away, your ability to generate purpose in the world may not be that clear. Separately, every person knows. Everyone knows why they want to live. And that's very powerful. So you may be asking yourself, I'm not a transplant surgeon, I'm not a nurse or a care provider. Does this matter to me? Oh, it does. Are you a coach? Are you a parent? Are you a dad? Are you a student? Do you own a business? Are you a leader? If the decisions that you're making in life aren't tracking towards one of those four, take a step back and ask yourself, is this the right choice or is it not? As we wrap up an incredible day and evening of impressive talks for each of the incredible speakers on this incredible stage, I'd like you all now to please close your eyes, including my children over here. Close them. Take a deep breath and ask yourself, what is my reason to live? Thank you very much.